Like a lot of busy women out there, I tend to put my health on the back burner. But it's important for all of us to prioritize our health needs a bit more and act when necessary. Hi, I'm Sharda Harrison, and welcome to On the Pulse, where we look at everything health.
In today's episode, cervical cancer and how best to fight the disease. An innovation that shrinks breast cancer tumors. And finally, the lowdown on menopause, why it happens and how women can deal with it.
As a woman, getting a pap smear regularly is something I never question. I know how important they are because pap smears are one of the best ways to detect potential signs of cervical cancer. But like a lot of women out there, I can't say I know a whole lot about the disease, and maybe we should learn more about it.
Each year, more than 300 Singapore women are diagnosed with cervical cancer, and close to 180 women die from it annually. Dr. Ida Ismail Pratt is a practicing obstetrician and gynecologist, and over the past 10 years, she has been championing the fight against cervical cancer.
Like any other part of the body, cancer can also grow on the cervix. It does take about 10 to 15 years for cervical cancer to develop.
Right.
Most cervical cancer does not have any symptoms.
No symptoms at all?
No symptoms at all. So if women have abnormal vaginal bleeding or lower abdominal pain, then usually the cancer has already developed and is advanced cancer at about stage 3 or stage 4.
That's actually really scary. So what are the causes of cervical cancer?
99.7% of cervical cancer is caused by a virus called human papilloma virus, or HPV for short.
Right.
This virus is very common. It is as common as the flu virus. We know that there are more than 100 types of this virus, but only about 14 types that we currently know that is cancer-causing. Of the 14 types, 2 of them are the commonest in terms of causing cervical cancer. Both men and women will be exposed to the HPV virus. However, our immune system has been engineered to get rid of the infection, like how we get rid of any virus. But for some women, this virus can stay in their body for a very long time. And this is what we call persistent infection. And this can eventually develop into cervical cancer in future.
I see. How does one contract an HPV infection?
So HPV is transmitted by skin-to-skin contact. The most common way is by sexual activity.
So anyone who's sexually active can get it?
You're right. If you are sexually active, then you are at potential of being exposed to one of the cancer-causing HPV. However, it's not just about sexual activity. The HPV itself, when it is on our skin, it is not harmful. The problem is when the virus gets into the fragile skin, which is our mucous membranes in our throat, in the cervix, in the vagina, this is when it actually becomes active and slowly develop abnormal cells that can turn into cancer.
Dr. Ida explained that the virus can spread through vaginal, anal, or oral sex, and cancers caused by HPV can include not only cervical cancer, but anal, throat, vulva, penile, and vaginal cancer as well. It is estimated that 8 in 10 men and women will be exposed to the HPV virus at least once in their lifetime. But there are ways to minimize our exposure to HPV.
One of them is to make sure our immune system is as healthy as possible. Other ways is to stop smoking, reduce the number of our sexual partners, and also wearing condoms or barrier contraception. And this can also reduce your exposure to the virus.
Right. So if we can't prevent HPV infection, what are some ways we can prevent cervical cancer?
So the 2 main ways is one, by going for regular cervical cancer screening, and second, by getting the HPV vaccine.
Can you elaborate more about the screening?
Cervical cancer screening allows us to detect abnormal cells on the cervix before they become cancer. In Singapore, our National Cervical Cancer Screening Program recommends that women from 25 to 29 years old who's ever had sex to go for their regular pap smear every 3 years. Now, for women aged between 30 to 69 years old, we do recommend a HPV DNA test to be done every 5 years. An HPV DNA test is done exactly like a pap smear. The only difference is that we do not look for abnormal cells, we look for the virus itself on the sample.
So it's very good that we can detect abnormal cells. Now, you mentioned something about a vaccine.
Yes, the HPV vaccine is an anti-cancer vaccine. In Singapore, the HPV vaccine is licensed for both men and women from 9 to up to 45 years old. The best time to give the vaccine is before you're ever sexually active and when you're young, because at this time, your immune system is much stronger and you can get more than 90% protection from some of the common cancer-causing HPV. In 2019, the government launched the school HPV vaccination program, which means that all girls in secondary 1 get the HPV vaccine, and this will help to protect them from future exposure when they're much older.
Oh, that's just wonderful. I'm a bit jealous now. I really wish that I could have had that program. So what about males? Should they get vaccinated as well?
I would recommend the men to get the vaccine as well. We do know that if we vaccinate the men, it also reduces the transmission of the cancer-causing HPV to their female partners, and hence reduces the chances of their female partners from getting cervical cancer in future. Now, in addition to that, it has been shown to protect them from anal cancer in future as well.
The benefits of the HPV vaccine has been recognized by the Singapore Cancer Society too. They started an HPV immunization program in 2022 in hopes of protecting women against an HPV infection which may lead to cervical cancer.
So the Singapore Cancer Society has this HPV immunization program that is funded by Temasek Foundation. Girls who are 18 to 26 years old with a valid CHAS orange or blue card, they can actually get it done at GPs island-wide at no cost. This is really to help girls in the catch-up cohort, I would say, because they missed out from the school-based immunization program at 13 years old. So Singapore Cancer Society is coming in to provide it to them. So up to date now, we have already almost vaccinated close to 5,000 girls, and we just started the program actually last year. So we are quite heartened to see that girls are actually coming forward to get themselves vaccinated and to protect themselves from cervical cancer.
Wow, that's fantastic news. So apart from vaccinations, are there any other initiatives or campaigns that the Singapore Cancer Society is doing in regards to cervical cancer?
Singapore Cancer Society also offers cervical cancer screening at no cost for women who are above the age of 25 years old. We have a clinic at Bishan, so they can actually get it done very conveniently. They just have to go onto our website and then they just book an appointment with us. The reason why we also provide cervical cancer screening is because just the vaccine itself is also not a full 100% coverage. After the HPV vaccination, they have to go for their cervical cancer screening as well.
Right, so even after you get the vaccination, you still have to be screened because there's a possibility that you could still get cervical cancer.
They have to do both, in a sense.
I see, I see. What can we do to reduce the incidence of cervical cancer in Singapore?
In a lot of other countries, to be honest, cervical cancer is no longer in the top 10. But in Singapore, we have been in that 10 mark for over a decade. So with the vaccination and screening, we may then be able to see more women to be protected against it. Yeah, because cervical cancer itself is actually the most preventable cancer among women.
Like a lot of women and men out there, I may have had an HPV infection sometime in my life without knowing it. But thankfully, my pap smears have always been clear. And after learning all that about cervical cancer, I'm going to make sure I never miss a screening.
Up next, a device that can help with breast cancer treatment.
When I was 14, my best friend's mother was diagnosed with breast cancer. That means that my friend herself is now at higher risk and she's worried about getting cancer. Personally, I have no risk factors, but breast cancer is the most common cancer among Singapore women.
Between 2016 and 2020, more than 12,000 women were diagnosed with breast cancer here. It also contributes to about 1 in 6 cancer deaths among females, making it the leading cause of cancer death. But breast cancer also has consistently higher survival rates than most other cancers. And advancements in its treatment continue to be made. One such new therapy is OncoFTX. Associate Professor Alfredo Franco Obregon is the man leading the team behind it.
Chemotherapy is the first line of defense against breast cancer. And although chemotherapy is very effective, it's a little bit over-aggressive. Although it actually kills cancer cells very effectively, it also implicates healthy tissues. And some of these healthy tissues are important. The oncologist finds themselves in a very complicated situation where they have to find the right dose to control the cancer without implicating healthy tissues. So our job is really to make the oncologist's job easier. What we would like to do with this technology is to actually improve the killing of cancer cells in conjunction with chemotherapy while sparing healthy tissues. And this has actually been borne out by our preclinical trials.
I see. So how does that work?
How it works is that we have a bed structure, and a woman with breast cancer, she lies belly down on the bed. We have a coil, a small circular little cup that sits in the bed. Now, when the woman lies down, her breast falls into the coil system and it's localized. These coils emit a low-energy magnetic field. The fields are no greater than those fields that come off of your laptop. It really is how they're delivered, and they're delivered within this coil system that makes them effective.
Professor Alfredo explained that the magnetic field targets both healthy and cancer cells. But while healthy cells can deal with the magnetic field, the cancer cells are pushed into a state of metabolic catastrophe. In layman's terms, it basically means the cancer cells become so overwhelmed, they have a meltdown.
And I understand with your therapy, it's outside of the body, right? So it's not invasive at all.
Exactly. So the fields actually are delivered from the outside. A field penetrates deep into the breast where the tumor resides. No incisions, no injections. That's actually a very big benefit. And also it's localized. So in contrast to chemotherapy, which is delivered in a system and all cells are subjected to the chemotherapeutic drug, these fields are localized to where the tumor is.
Right.
In the future, we hope to roll this out in other cancers as well. Prostate cancer, gastric cancer, colorectal cancer. Those are all target cancers that have the same metabolic disruption that breast cancer has. So they will be sensitive to our field treatments.
Wow, that is groundbreaking work, right? It has so much potential, and I'm so excited for it. So what is your ultimate hope with this device?
Our first objective is to improve the effectiveness of chemotherapy. But our ultimate hope is that if we are able to catch the cancer early enough, and with our field treatment, we can actually reduce the need for chemotherapy. In other words, if we're able to effectively control the cancer in early stages, that would potentially allow us to reduce the dose, that would actually be very, very favorable.
It was very exciting, and Professor Alfredo told me that so far, the preclinical study his team has run has shown that these magnetic fields do not cause any adverse side effects and that they improve chemotherapy outcomes. But OncoFTX still has to undergo a 1-year clinical trial to make sure that it's entirely safe for intended use. This clinical trial is being done over at the National University Cancer Institute. Consultant and clinician Dr. Jolene Lim is the one in charge here.
So we're actually really excited about this clinical trial. What we're trying to really determine here is that it is safe for our patients, meaning that because we're delivering local therapy, we need to make sure that it doesn't cause any local side effects like skin changes, or for patients who ultimately need surgery, that it doesn't actually affect how they would heal after surgery. Once we have established safety, we can then go on to establish efficacy. How well does this work together with chemotherapy? We have to ensure that the treatment does not increase the side effects that patients commonly experience with chemotherapy.
Right.
Yeah.
According to Dr. Lim, preclinical trials so far have shown that the treatment is most effective when combined with chemotherapy. And so she aims to offer the trial treatment to patients before each chemo session. These patients will be those with locally advanced breast cancer where the cancer has yet to spread.
We absolutely hope that we can actually help to improve the outcomes for our patients. And part of it, of course, is to try and improve the shrinkage of the cancer cells locally. Our hope is that by using this device together with chemotherapy, we can increase the odds for our patients that by the time they get to surgery, there is actually minimal or even no cancer cells left behind, and that will give them a much better long-term outcome.
Breast cancer and its treatments is scary to think about, but it's good to know that perhaps one day innovations could make cancer therapies less scary.
After the break, we'll look at menopause and we'll get the lowdown on how to deal with it.
As women age, there's some things we may not exactly look forward to. You know, hot flushes, mood swings, weight gain, incontinence. Yes, I'm talking about menopause.
All women, that is half the population, will experience menopause at some point. Our periods will stop. And according to the Singapore Medical Journal, the average age when that happens in Singapore is 49.
But we don't really talk about it, and honestly, I have questions. Why does the end of menstruation lead to all those diverse symptoms I mentioned? I need an expert on this.
And that's brought me to the office of obstetrician and gynecologist, Dr. Christopher Eng.
So menopause is a natural event that all women go through at some point in their life. And it basically means their ovaries stop working and the eggs in the ovary, they run out. So the female hormones, progesterone, estrogen, are then very, very low. And women are not used to this low level. They start getting the symptoms of menopause, which can vary from woman to woman. This chart pretty much summarizes what a lot of the short-term symptoms that women experience. So things like hot flush, night sweats are the most common. Of course, the other thing was irritability, depression, some can't sleep, and this fuzzy thinking. And of course, the sexual part, the dry vagina, low libido. Not everyone experiences all of them, and even the severity varies.
You mentioned hot flashes.
Yeah.
And I remember when my mother was in her 50s, she used to complain a lot about hot flashes.
Yeah. Some of my patients say in the middle of the night they wake up and they're extremely hot and they're sweating. And the husband's all wrapped up in his duvet because he's really, really cold.
Yes.
And then the other one was the emotional part, right? You know, where they, for no reason, they get very teary and they cry, or, they get very irritable about certain things. And then some of them tell me, I've been a horrible person recently, to my family.
So, I recognize that in myself, I do get mood swings when I'm going through my menstrual cycle.
Yes.
Are they similar?
So similar, right? Because it's all to do with hormones, right? So the main fundamental difference is that for menopausal women, this can be a daily affair because their hormones are low. Whereas a PMS, it's cyclical. And when the period comes, the symptoms go away.
Right, okay, I understand that.
So the question is why some women get these symptoms and why others don't, right? It's just the way in which women react to low hormones. Some women adapt very well, so the body is able to compensate and adapt. Others, the drop is too drastic, or there's different sensitivities to hormones. A slight fall in their hormones, and then they get it.
I see, I see. There were so many symptoms: irritability, mood swings, skin dryness, sore joints. How do we treat, some of these other symptoms
Right,
as
so
well?
if we talk about short-term symptoms like hot flush, night sweats, mood swings, insomnia, then some people try herbal remedies or over-the-counter things, and if that works, great. Of course, there's the conventional hormone replacement therapy, so they take estrogen, progesterone, and these are in the form of either oral tablets, sometimes they're even creams, but beyond 5 years, it increases the risk of breast cancer. So normally what we'll do is if we do put them on it, maybe initially, 6 months, 1 year, then stop and review and see whether these symptoms are still persistent because their menopausal symptoms may have gone, right?
Yeah.
So we can stop.
So what about the lifestyle changes that might have to change as a way to manage these symptoms?
So lifestyle changes, exercise, diet, good sleep. So these, even if you weren't menopause, I mean, that's generally good for general health, right? There's no one size fit all. There's no, like, okay, you come in here, you tell me you have these symptoms, and then this is the set prescription. Because all women are different, right? So it's a bit of a trial and error.
So what should a woman do when, she experiences symptoms? Should she see a doctor right away?
So it depends on how badly it affects the woman. When it happens almost daily, and it affects their lifestyle, then I think those are the ones that probably they would need to come and see the doctor.
Right.
And then have an assessment to see, like, how bad is this? And then maybe either try lifestyle changes that we mentioned earlier, or try some of the remedies that we've mentioned along with lifestyle and see what works. Menopause is a natural event and there's no way they can avoid it. There's some women who look forward to menopause because not to have menses on a monthly basis can actually be quite liberating to some women.
Yeah.
And then, funny enough, because once they menopause and their female hormones drop, right? So their risk of breast cancer actually falls.
So there you have it. There are some positives to menopause, and the symptoms may not even be that bad. But I'm glad I found out more, because now when it's my turn, I know what to expect and I know what actions to take if necessary.